الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Streptococcal disease by Professor Mahmoud Hani Sulaiman. Summary. The infectious agent Streptococcus pyogenes or group A streptococci GAS has around 80 serologically distinct types. These producing skin infections are of different serological types of those causing throat infection. Epidemiology. Acute pharyngitis is one of the most common reasons for seeking medical advice. GAS will lead to about one-third of pharyngitis in children, 10% in adults. Outbreaks occur in child care settings and institutions. Epidemiology. Most common infection is streptococcal pharyngitis. Superficial skin infection include impetigo, erysipelas, cellulitis. Severe life-threatening conditions include scarlet fever, bacteremia, pneumonia, necrotizing fasciitis, myonecrosis, streptococcal toxic shock syndrome. Post-infectious sequelae include acute traumatic fever and post-streptococcal glomerulonephritis. It is a long list caused by streptococcal infection. Epidemiology in Egypt, incidence of symptomatic pharyngitis in age group of 2 to 13 years, about 18,000 per 100,000 children per year, at least twice as much children per year, at least twice as much. So its range is from 18,000 to 36,000. Usually about one-third of these cases are culture positive for beta hemolytic streptococci, but in about half of them bacteria would not have an etiological role. So incidence of streptococcal pharyngitis range from 3,000 to 6,000 per 100,000 children in year. Incidence of rheumatic heart disease range from 9 to 24 per 100,000 children per year. Children less than 14 years in Egypt. So this is the epidemiology in Egypt. Direct contact with mucus. The transmission occurs by direct contact with mucus from nose or throat of infected person or by contact with infected wounds or sores on skin. Those with strep throat or skin infections are most likely to spread infection. They are the source. Carriers are much less contagious. It is important to complete entire course of antibiotics to eradicate the organism from the throat. It is not likely that household items like plates, cups, or toys spread these bacteria. Outbreaks of streptococcal infection may occur due to ingestion of contaminated food such as milk, milk products, and eggs. This is why we examine a throat swab for food handlers for this organism. Risk groups. Invasive disease. Invasive disease, the risk group for having invasive disease are elderly, diabetic, immunosuppressed, persons with chronic cardiac or respiratory disease, skin lesions. Non-invasive disease, the risk factors is for children, especially crowded elementary school is at high risk. Reservoir for this organism are humans. Period of communicability. With appropriate antibiotic therapy, GAS is communicable only for 2 days. In untreated, uncomplicated cases, communicability can last for 21 days. Communicability can be prolonged in untreated, complicated cases. Susceptibility and resistance. Pharyngitis and tonsillitis common in child 5 to 15 years. Pyoderma less than 5 years. Most people in their lifetime will develop GAS throat or skin infection. Many of throat infections may be subclinical. This picture shows streptococcal tonsillopharyngitis in this arrow and this arrow. Exudate present on the enlarged erythematous tonsils. This multiple pyoderma lesions on lower extremities. Here, facial erysipelas. The lesion is well demarcated from surrounding skin and illustrates the typical butterfly distribution. Incubation period 1 to 3 days. Clinical features of GAS include superficial infections as pharyngitis, impetigo, and pyoderma, scarlet and purple fever, severe invasive disease like necrotizing fasciitis, toxic shock syndrome, septicemia, puerperal sepsis. Post-streptococcal immunological sequelae include acute rheumatic fever and acute glomerulonephritis. Clinically, toxic shock syndrome is severe illness with shock and multi-organ failure. NF presents with severe local pain. Necrotizing fasciitis presents with severe local pain and rapid destruction of tissue. Rheumatic fever is a leading cause of acquired heart disease in young people worldwide. Also for diagnosis, these are the Jones criteria for diagnosis of acute rheumatic fever. They are either major criteria, minor criteria, and supporting evidence. Major criteria: carditis, polyarthritis, chorea, erythema marginatum, subcutaneous nodules. Of course, the details of these is found in internal medicine, in cardiology. Minor criteria for acute rheumatic fever, arthralgia, laboratory findings of elevated acute phase reactants, prolonged PR interval in the ECG. Supporting evidence: positive throat culture or rapid test for GAS antigen or elevated or rising streptococcal antibody test. Still in diagnosis, superficial infection, examine for the organism in infected tissues. Invasive infection, examine blood for the organism. Throat swab of limited value because most of examined are positive. A specific serogrouping procedure. Definitive identification depends on specific serogrouping procedure. Antigen detection tests are available for rapid identification. Increase in serum antibody titer, anti-streptolysin or titr, or anti-hyaluronidase, anti-DNase B may also be demonstrated in sera taken in acute and convalescent phases of disease. Preventive measures. No vaccine available. Foodborne disease can be prevented by pasteurizing milk products, careful preparation, sanitary storage of high-risk foods, particularly eggs, routine examination of throat swabs of food handlers. Still in preventive measures, a spread of GAS infection can be decreased by good hand washing, good hand hygiene, especially after coughing, sneezing, and before preparing foods for eating. Examine patients with sore throat to find out if illness is strep or not. If positive strep throat, patient must stay at home. This to prevent from spreading the disease. Stay at home from work school, or daycare until 24 hours at least after taking an antibiotic. All wounds should be kept clean and watched for signs of infection, redness, swelling, and pain at wound site. Still in preventive measures, patients with signs of an infected wound, especially with fever, must immediately seek medical care. However, in high-risk people, antibiotic treatment may be given. This is the summary of prevention, and this will be explained in next slides. This is the summary: primary prevention, secondary prevention, tertiary prevention. Primary prevention: reducing overall exposure to GAS, primary prophylaxis, primary prevention of skin infections, antibiotic treatment to interrupt transmission of organism, vaccine which is under trial. Till now there is no vaccine to strep. Secondary prevention: early and correct diagnosis of acute respiratory infection, secondary prophylaxis. Tertiary prevention: management of rheumatic heart disease patients, treatment and rehabilitation of invasive GAS infection. Primary prevention: reducing overall exposure to GAS, interventions that decrease number of organisms in a population or decrease likelihood of transmission. The most important are improved living standards and improved hygiene. And it is important to prevent crowding, decrease crowding in a class. It is economic. Primary prevention: a 10-day course of an appropriate oral antibiotic, oral penicillin V, or a single dose of long-acting intramuscular penicillin, benzethine penicillin G, if given within 9 days of onset of symptoms, preferably just when symptoms appear. Within 9 days of onset of symptoms of GAS pharyngitis will prevent most sequelae of cases. Primary prevention. Primary prevention of skin infections. Because GAS skin colonization precedes skin infection, superficial skin trauma is a predisposing factor. So decrease GAS colonization via washing or underlying infestations, e.g. scabies control program. Secondary prevention refers to early detection, so intervention instituted. The only secondary prevention measures widely practiced are those aimed at acute rheumatic fever and rheumatic heart disease. Regular administration of antibiotics, IM intramuscular, benzethine penicillin G for 3 or 4 weeks, or twice daily oral penicillin V for years to people with acute rheumatic fever or rheumatic heart disease to prevent recurrence of acute rheumatic fever. Tertiary prevention refers to measures decrease severity or long-term impact of strep. Mainly refers to management of patients with rheumatic heart disease or sequelae of invasive strep infections. Management of rheumatic heart disease patient, treatment of cardiac failure, prevention and management of endocarditis and stroke. Benefit of strep prevention in Egypt. If you do the program, this will reduce the cost very much. Why? Assuming high incidence of rheumatic heart disease, 100% effectiveness of antibiotic treatment, 12,000 of children must be treated to deal with 2,000 cases of strep pharyngitis and so prevent 24 episodes of rheumatic heart disease, i.e. 5 treated patients for 1 prevented case of rheumatic heart disease. In less favorable scenario, 24 1,000 cases treated to prevent 9 cases of rheumatic heart disease. Additional benefits from an aggressive treatment strategy represented by prevention of suppurative complication. Control of case for at least 24 hours. Child feels well. That's to say, infected children excluded from schools until they received antibiotics. So, for at least 24 hours, and the child feels well. People with skin lesions should be excluded from food handling until infections have resolved. Control of contacts. Examine symptomatic contacts for diagnosis. Few contacts of GES will develop invasive strep disease. Antibiotic treatment may be appropriate for increased risk of infection. Treatment of pharyngitis. Penicillin V is a drug of choice. Prompt, because it will decrease the clinical cause, decrease transmission, decrease the risk of suppurative sequelae, and to prevent acute rheumatic fever when given 9 days after illness onset, within 9 days of illness onset. For all patients with acute rheumatic fever, complete course of penicillin or another antibiotic, strep pharyngitis is given to eradicate group A beta streptococcal, beta hemolytic streptococci from throat. Oral amoxicillin is another alternative, and here is the dose. For 10 days, oral penicillin V or amoxicillin given multiple times per day for 10 days comes as a more palatable suspension. Treatment of pharyngitis continued. This is the dose of oral penicillin V. For children weighing less than 27 kilograms, this is the dose. Please write it. And this is the dose for adolescents and adults. To prevent acute rheumatic fever, oral penicillin is given for 10 days regardless of promptness of clinical recovery. Carrier state can be difficult to eradicate. Oral clindamycin, and here is the dose, is used for this to eradicate carrier state. Prevention of sequelae. Acute rheumatic fever and acute glomerulonephritis are serious non-suppurative sequelae of strep infections. Rheumatic fever in 3% of untreated patients with acute strep pharyngitis occur. Current incidence of endemic infection is not known, but is believed to be substantially less than 100%. 1%. Patients with well-documented history of acute rheumatic fever and patients with documented rheumatic heart disease should be given continuous antimicrobial prophylaxis. Here is the map of the world and shows the incidence, presence of rheumatic heart disease cases per 1,000 population. Here in Egypt, it is in the range of 1.8 per 1,000 population. Duration of prophylaxis for people who have had acute rheumatic fever. Either without carditis, 5 years. With carditis but without residual heart disease, 10 years. Rheumatic fever with carditis and residual heart disease, 10 years. This is the chemoprophylaxis for recurrence of acute rheumatic fever: penicillin G, penicillin V, sulfadiazine or sulfadoxazole, and macrolide or azolide, and the preparation and the dose. Please write it. Control of environment standard infection control procedures should be applied. We made at the beginning in general epidemiology lectures, complete lectures about this. Outbreak measures. Outbreak management is dependent on the setting and specific disease. وفي النهاية لا أقدر أن أقول الحمد لله رب العالمين و thank you for your listening.